In today's lecture, we'll be discussing about the knee joint. So it will be a 2 hours class. So I'll request everyone to listen it carefully, and in between the explanation, we'll take a break of 10 to 15 minutes. Okay. Now, if you see the knee joint, I have given I think 3 or more than 3 classes for this particular joint. Close the door. Why? So first in this session, in these 2 classes, we will be discussing about the structure and the function of the knee joint. And another class is there which will be dedicated specially for the applied importance of the knee joint. Okay? So the way we have studied the hip joint, and yesterday I think one group has given the seminar also on hip joint. In the similar way, you have to study the knee joint. But there are some differences, and obviously knee joint is one of the most complex and complicated joint of our body. Now, before I start, can anyone tell me what are the points which I have shared with them in order to describe any joints? What are the topics? First of all, first you have to classify the joint. Okay, first point is stop talking and listen carefully. No other activities inside the classroom. Come first. Close the door. Come first. Okay, so if you are not willing to attend the class, you can leave. But no other activities inside the classroom, no assignment, no practical, nothing. I will not repeat this. Okay, so what are the points? Do you remember that I have written those points? What is the first point? Classification. Next, very good, articular surfaces. This side must participate. Don't remain silent inside the classroom. What is the third point? Ligaments. So you have to write the list of the ligaments. Next. What is next? Which one? Not directly relation. Okay, you have to include the bursa also. Okay. No, before this one relation, you can include the bursa. Okay, after that, go to the relations. Then nerve supply, blood supply. After that, stability of the joint. Why stability is important? Because in lower limb, mostly you have to mention the stability of the joints. The important joints which are present, you have to mention the stability. After that, as I said, nerve supply, blood supply is there. Then movements. Now, in movements, what are the points, additional points I have mentioned? First of all, you have to mention the movements. What are the movements taking place? Okay? Next is the axis around which the movements are taking place. Third is the muscles causing them. So these 3 points are compulsory. You have to write. Next, the additional part which you have missed yesterday also. The group which was giving the presentation, they had missed that point. That means, see, every time whenever any movement is there, a range of motion is there. Okay. What is the degree of extension? What is the degree of flexion? So that must be there. After that, what are the possible ways that you can increase the range of motion? For example, if you remember that day, I have given you an explanation. Now, in case of flexion of the hip joint, if the knee is extended, then it is limited. Suppose knee is extended, you can't do flexion of the hip joint beyond 90 degrees. Now, if you flex the knee, then see the range of movement is increased. Okay? So, these are the points you have to include. And for that, you don't have to by heart. These are the activities every day you are doing. So, whenever you are studying from any book, correlate with the activities which you are doing. इसके लिए मतलब you don't have to by heart anything. Okay. For example, that day while explaining the movements of the hip joint, I have told you about the abduction and adduction also. Now, in case of adduction, the range is very less because the opposite thigh will prevent doing adduction. At that time, what you have to do? Just you have to flex the knee, semi-flex knee, so that you can increase the range of movement. And this is done in case of cross kick. When footballer is playing football, you have seen they used to do like this. This is the cross kick. तो इसमें क्या हो रहा है? This is the adduction. कि देखो adduction हो रहा है. Now what you are doing? You are increasing the range of movement. Okay, whenever it is required. So these are the day-to-day activity. Everyone you know how to play football mostly. Okay, you have seen watching football. To see, use all those things. You don't have to buy heart. Now yesterday the group who have given the presentation, it was nice, but I was disappointed. I was expecting that they will be adding the movements, sequence of movements or the mechanism of movements occurring in the hip joint. I have shared the diagrams, I have shared the explanation also, still they have not included. I don't know why. Even when the question was asked, okay, that time also they were silent. Okay, so during the time of exam, अगर मान लो movement से question आया, so you have to explain the mechanism. So today we will see in case of knee joint also, the movements, whatever is taking place, a mechanism is there. Some sequences are there. Based on that, you have to explain, you have to describe the movements. Okay, so here also, please correlate those movements along with your day-to-day activity. That will be easier for you to understand. ठीक है, सब कुछ by heart करने से याद नहीं रहेगा, not possible. Okay, let's start with the knee joint. So as you know the points which you have to write for any of the joint. Okay, whatever we have studied. So I am not writing the points again. I will assume that you know those points. Okay. So first, if we see the introduction of the knee joint, as you can see the diagram showing the knee joint, two diagrams are there. Okay. Now, the knee joint is the most superficial joint of our body. Okay. Along with that, it is the most complex joint of our body. And in terms of surface area, it is the largest joint of our body. Okay, so these are some peculiarities in case of knee joint. Next, if anyone asks you the knee joint, how it is formed? The knee joint is formed between the medial and lateral condyles of femur and tibia, and along with that, patella is also included. Can anyone tell me which joint, which bone is excluded over here from this picture? Fibula. Fibula is excluded. Okay, so fibula. Why? For what? Okay, so fibula is excluded from the knee joint. Next, now we know that knee joint is a weight-bearing joint. Whenever you are standing erect, knee joint, both the knee joints are bearing your weight. Okay, and it is the most stressed joint of our body because of the weight which is bearing by the knee joint. And three important articulations are there. What are those three important articulations? As you can see, medial tibiofemoral, lateral tibiofemoral, and patellofemoral. These are the three important articulations in the knee joint, as you can see in the diagram. Next, functionally, if you see the knee joint, it is condylar and along with that modified hinge joint. Condylar as well as modified hinge joint. Why? Because the flexion and extension is taking place. However, along with the flexion and extension, some rotational movements are also taking place, and that we'll see in the movements of the knee joint. सिर्फ flexion extension नहीं हो रहा है. Along with that, some rotational movements are also taking place. Okay, that you have to know, that you have to understand, and that is the most complex part of the knee joint. ठीक है, ये जो rotational movement होता है. Now, if you remember the synovial joint chapter which we have studied earlier, in that, in classification of the synovial joint, different types of synovial joint are there. Among them, hinge variety is also there. Now, can anyone tell me what are the movements taking place in case of hinge joint? What is the axis? What are the examples of the hinge joint? What are the speciality of the hinge joint? If not, then it will be difficult for you to understand. Around transverse axis. What else? Movements, okay, flexion and extension. What are the other things? What is the shape of the articular surface in case of hinge joint? Okay, so these things are important because that synovial joint chapter which you have studied is directly correlated with the joints which you are studying now. And that time I have mentioned about all those things. Okay, so I request everyone to please revise the synovial joint chapter, at least the synovial joint chapter. Now, if you remember in synovial joint chapter, I have taken it in two different parts. First, the structure of synovial joint, and then the movements of synovial joint. ठीक है तो I think lecture videos are available, you can check those also, or if you are having any general anatomy book, anyone, you can study from there. Okay, but synovial joint you will not get in other books, only you have to refer to the general anatomy book. Now if you see the knee joint, here what two things are included: medial and lateral condylar articulation between tibia and femur. Okay, now these articulation are incompletely divided by menisci. That means two condyles are there. Now those two condyles are of tibia and condyles are of femur. Okay, now these two articulations are separated incompletely by menisci. Okay, I am coming into that. What are those menisci? Now the condylar articulations are separated sagittally. The condylar articulations are separated sagittally by intercondylar septum, as you can see in the diagram. Sagittally it is separated by intercondylar septum. Now intercondylar septum is mainly made up of adipose tissue which is covered by synovial membrane. ठीक है, adipose tissue रहता है which is covered by synovial membrane, which is forming the intercondylar septum, and this intercondylar septum is present sagittally. ठीक है. Next, the division creates two segments, that is the anterior short segment and the posterior long segment. Okay, and there is a foramen also that is called as intercondylar foramen. You can see this is the intercondylar foramen. Next, the anterior segment persists a infrapatellar synovial fold. Okay, you can see infrapatellar synovial fold is there from the anterior segment, or also called as LR fold. And posterior segment contributes in this posterior segment. Okay, it helps in the formation of the cruciate ligaments. I hope you have heard about the cruciate ligaments of the knee joint, anterior and posterior cruciate ligaments. Now, what happens? The femoropatellar joint, which is there, you can see the femoropatellar joint, that is the joint between the patella and the femur. Now, it communicates with the condylar joint through a semilunar space between the femoral condyle and free lateral margins of the infrapatellar fold. इसका मतलब क्या है? जो femoropatellar articulation है, this femoropatellar articulation is communicating with the condylar joints. That means the knee joint by a semilunar space between the femoral condyle and free lateral margins of the infrapatellar fold. Okay, so that is the communication between these spaces of two separate articulations. Next, if you see the complete classification of knee joint, okay, complete classification. This is the complete classification of knee joint. So, suppose exam में question आया कि you have to write about the classification of knee joint. What will be your answer? In case of hip joint, till now the joints which you have studied directly you have written one classification, right? इसमें ऐसे लिखने से नहीं होगा. जैसे in case of hip joint, what you have written? Yes, wait, this side? Yes, what is the classification of hip joint? Stand up, last bench. Yes, no, last bench. What is the, stand up, what is the classification of hip joint? Wait. What is the classification of hip joint? Can you see what is written? What is the classification of hip joint? Can you tell me how the hip joint is formed? Between which bones the hip joint is formed? See, this is the condition. अभी समझ में आया एग्जाम में मार्क्स क्यों नहीं आता है? This is the condition. I think more than 3 classes has been taken for hip joints. Okay. You do one thing, go and sit at the last bench. Anyway, in case, say come here, don't be so fool, come and sit here in the first bench. Okay, in case of hip joint, as you know, what is the classification? It is ball and socket type of synovial joint that is also multi-axial. In one line, you have written the classification. But in case of knee joint, the classification is not that simple. Repeatedly mentioning this. Okay, that means agar knee joint se question aya for the structure, when you will write the classification, you can't write that it is a hinge joint. No, if you are writing like this, you are wrong. So what you have to do, first of all, you have to mention that it is modified hinge joint. Okay, why it is modified hinge joint? Because some rotational movements are also taking place along with the flexion and extension. That's why it is called as modified hinge joint. Okay? Next, condylar joint. Now, just now I have mentioned about the hinge joint. Now, in case of hinge joint, please keep this in mind. Strong collateral ligaments are there on either side. कोई भी hinge joint हो, उसमें क्या रहता है? Strong collateral ligaments रहता है. Either side means medially also, laterally also. Same thing we will see in case of knee joint. Okay, strong collateral ligaments are there. Now, these collateral ligaments are providing stability and restrict the movements in other plane. For example, this is the elbow joint. Pure example of this one, hinge joint. Now, in elbow joint, only flexion and extension is possible. Okay? Can you do any rotation in the elbow joint? Not possible. Now, that is restricted or that is prevented by the presence of these strong collateral ligaments. Okay? But in case of knee joint, the exception is strong collateral ligaments are there, but still some rotational movements are taking place. That's why it is called as modified hinge joint. Is it clear? Okay. Next is the condylar joint. Why it is condylar joint? Anyone? Why it is condylar? Because the condyles are there, okay, for the articulation. That means femoral condyle and tibial condyles. That's why it is called as condylar joint. Next, why it is complex joint? Because the joint cavity is partially divided into two compartments, upper compartment and lower compartment by menisci. In other cases, articular discs are present. For example, sternoclavicular joint, temporomandibular joint. In that, you will be getting complete articular disc. Here, instead of complete articular disc, we are getting menisci, okay, which is partially dividing the joint compartment or joint cavity into two compartments, upper compartment and lower compartment. That's why it is called as complex joint. Next, why it is compound? Because more than two bones are taking part in the formation of the joint. Okay? So we know that in case of joint, two bones are articulating with each other. Now, if it is more than two bones, then it is called as compound joint. So what are the three more than two bones? Femur is there, tibia is there, patella is also there. That's why it is a compound joint. Okay? So this is the way to write about the classification. And lastly, the patellofemoral articulation. It means the joint between the patella and the femur. I hope you have studied the femur. Have you seen where the patella is articulating with the femur? So that articulation is also a type of synovial joint, and that is the plain synovial joint. Now, I know in some book it is written as saddle type of joint. Okay? But it will be plain synovial joint. And there is a reason. If it is saddle type of joint, then the requirements are the articular surfaces must be concavo-convex. In case of saddle variety, the articular surfaces must be concavo-convex. Now here, the concavo-convex articular surfaces are not present in both the cases. Next, in saddle type of joint, the movements are taking place in two different planes. Here, the movements, which type of movements are taking place? Only gliding movements. Okay, so that's why it will be plain synovial joint. So this is the complete classification of knee joint. This is the way you have to write about the classification of knee joint. सिर्फ एक ही पॉइंट लिखने से नहीं होगा. Now this is the overview of the complete classification. As you can see, modified hinge joint. That also synovial, condylar, complex and compound. Now in case of condyles, we are getting the tibial surface, intercondylar surface and patellar surface. Here tibial condyles, lateral, medial, tibial condyles are there. And which surface of the patella is taking part in the formation of the joint? That is the posterior articular surface. That also posterior 3/4 area of the patella. Patella, I hope you have seen. Osteology में हो गया patella? Very good. So you have seen and you know that patella is the largest sesamoid bone. Patella is the largest sesamoid bone. Now जो patella है उसका जो posterior surface है. Now the posterior surface that also superior or upper 3/4 area is articular. Okay, remaining area non-articular. और जो anterior surface होता है that is rough and it is non-articular. Okay. Next is the articular surfaces of the knee joint. Now in the articular surfaces of the knee joint, what you have to mention? Any idea? When you will be writing about the articular surfaces of the knee joint, what you have to mention? We have to mention about the bones which are forming and the part of the bones which are forming the joint. तो इसमें क्या क्या आएगा? What are the things will come? First of all, you can see the condyles of the femur. Now, please note that whenever you are mentioning about the condyles of the femur, this is the diagram showing the anterior view of the condyles of the femur. This is showing the posterior view of the condyles of the femur. Okay. Now here you can see the intercondylar notch. Okay. Next, this is the tibia, superior view of the tibia. So here you can see two condyles. This is the lateral condyle. Okay, and this is the medial condyle. So can you see the difference between the lateral condyle and medial condyle? Can you see the difference? And in between the condyles, you can see intercondylar area and intercondylar eminence is also there. So which one is taller or which one is longer in case of tibia? Which condyle? Yes. So please note that because during the time of movement, we'll utilize this. Okay? So here, if you see the medial condyle, it is longer as compared to the lateral condyle. Okay? Next, what is this? This is the patellar articular surface. That also posterior view. Okay? This is the posterior view. So like this, we have to mention about the articular surfaces. Now in case of femur, two views are required because the articular surfaces extend posteriorly also. Now in case of condyles of the femur, medial and lateral condylar articular surface of the femur participates in the knee joint, as you can see in the diagram. Okay. Now it has patellar and tibial articular surfaces. Now if you see the patellar articular surface, it is present on the anterior aspect. यहाँ पे patella articulate होता है, right? You can see the patellar articular surface. Now, if you see the patellar articular surface, it is extending more on the lateral aspect. Okay, patellar articular surface is extending more on the lateral aspect. If you have seen the articulation of the patella with femur. Next, the tibial condyles. Two tibial condyles are there, lateral and medial tibial condyle. Now, if you see the medial tibial condyle, it is oval. Medial tibial condyle, it is oval, and lateral tibial condyle, it is almost circular in nature. Next, this medial tibial condyle is longer as compared to the lateral tibial condyle. And in between the condyles, you are getting the intercondylar area and the intercondylar eminence. Okay. Next is the patellar articular surface. Now here you can see the patellar articular surface. So in case of patella, the surfaces you can see this is the anterior surface which is rough, non-articular, and this is the articular surface of the patella. Now, have you studied this one in osteology class? Then you will know that means upper 3/4 of the posterior surface of the patella is articular. Okay? Now it is divided by a vertical ridge into lateral area and small medial area, and then another faint vertical ridge and two horizontal ridges, which is dividing the patellar articular surfaces into 7 different areas. Now those areas, okay, used to glide with femur in different degrees of movement. For example, if you see If you see this a particular area which is contact with the femur, it takes place in the mid flexion, this middle area in slight flexion, and this area adjacent to the apex in extension. And in full flexion, this particular area comes in contact with the femur. Okay, so different areas of the articular surface of the patella comes in contact with the femur at different degrees of movement. Okay, which is given over here in this diagram. Now, if anyone asks you what is the function of patella in case of knee joint, several times I have mentioned patella, patella, patella. In the classification also, one joint is there. Now the question is, what is the function of patella in knee joint? So if you see the function, it protects the knee from the front, but in doing the movements, essential functions are not there. Some functions are there, but important functions are not there. So first of all, it will protect the knee from the front. It hinders the beginning of the extension from extreme flexion and facilitates the end of extension by keeping the ligamentum patellae away from the transverse axis of the joint. Okay, these are some important functions of the patella. Okay, in knee joint. So significant function नहीं है, ठीक है? तो in movement, I am talking about movement. Significant function नहीं है. The most important function is it is protecting the knee joint from the anterior aspect, hinders the beginning of the extension and facilitates the end of the extension by keeping the ligamentum patellae away from the transverse axis of the joint. These are some important functions of the patella. Next is the ligaments of the knee joint. Now you can see the list. Can you see the list of the knee joint, ligaments of the knee joint? Okay, so here what you have to know or what you have to study, same thing related to the hip joint. That means the name of the ligament, okay, from where to where it is extending, and what is the function. These 3 points must be there. In case of hip joint, you have seen, we have explained or we have studied these as 2 important points. That means the proximal attachment and distal attachment. Here you have to mention it about the femoral attachment and tibial attachment, or superior attachment, inferior attachment, whatever you want. Okay, but that must be there. So these structures are, one part is attached to the femur and one part is attached to the tibia. Okay, ultimately दो भूमि है. Now there are some structures which are attached to fibula also. For example, lateral collateral ligament. ये देखो, can you see the fibula over here? This is the fibula. This is the tibia and this is the fibula. ठीक है? तो ये जो lateral collateral ligament, it is attached to the fibula, right? So few structures are there attached to the fibula. Remaining most of the structures are attached between the femur and the tibia. So that you have to know and where exactly they are attached and what are their functions, what are the important functions. Okay. Now for the ligaments of the knee joint, this diagram I have selected. Okay, this is an easy diagram, right? This diagram is an easy diagram and showing most of the structure. Now another important point, it's not possible to show all the ligaments in one particular diagram. Can you tell me why? Because of the views. All the structures are not present in one aspect. It is present in anterior part also, posterior also, and both the side. Okay? So for that at least 2 views are required. That means anterior view and posterior view to see all the structures. But still, I have managed to find this particular diagram where almost all the structures are manageable and almost all the structures can be seen. Okay? Now it's up to you which diagram you can use or you will be using in the exam. The diagrams are given in the books. Now if you see the list, the capsular ligament is there and along with that synovial membrane. Always remember, whenever you are mentioning the capsular ligament, कोई भी joint का capsule है तो साथ में synovial joint भी लिखना है. ठीक है? कोई भी, this is the rule that whenever you are mentioning the capsular ligament, उसका जो interior वाला part होगा, that will be lined by synovial membrane. But in case of joints, some points are varying, but synovial membrane is present, which is lining the inside or interior of the capsule. Okay, so that point must be there. Next, ligamentum patellae, tibial collateral ligament, fibular collateral ligament. Okay, together I have seen in some book it is written as collateral ligaments. Okay. Next, oblique popliteal ligament, anterior posterior cruciate ligaments, arcuate popliteal ligament, medial and lateral menisci, and transverse ligament. Okay. So we'll start with the which ligament first? Capsular ligament, followed by the synovial membrane. Now in capsular ligament, as I have mentioned, you can see, so you have to mention the femoral attachment, you have to mention the tibial attachment. When you have studied the osteology of femur or osteology of tibia, at that time, I hope you have seen in most of the books, the articular surface or in the articular part, the dotted lines are given, and that is showing the line of attachment for the capsule. Have you seen? If you take any osteo book or normal books which you are, your textbook which you are following, जैसे BTC हो गया, विश्राम सिंह हो गया, ठीक है? When you will see the osteology part of any of the bone, उसका जो articular surface होता है, ठीक है? उसमें जो joint capsule होता है, capsule का attachment that is shown in dotted lines. Let me show the diagram. हाँ, can you see this dotted line? ये जो blue color में dotted lines दिए हैं, can you see the dotted lines? What does it means? What does it indicates? Attachment of the joint capsule, okay, or attachment of the articular capsule. So here you can see the articular capsule are attached to the femur and it is attached to the tibia also. Now we have to describe the line of attachment. That's it. Now here you have to go on the anterior aspect also and you have to go on the posterior aspect also. Okay? So this is showing the anterior aspect. This is showing the posterior aspect. Same thing for the tibia also. This is the anterior aspect. This is the posterior aspect. Okay? So I think this diagram is easier. Now these are the 3D diagrams where you can see the posterior aspect of the joint capsule. Okay? So this is the knee joint. यहाँ पे जो joint capsule दिखाई दे रहा है, this is the posterior view of the capsule, knee joint. Okay? So you can use this diagram or you can use the diagrams which are given in your book. Okay? To show the line of attachment of the fibrous capsule. Now femoral attachment, it is attached about 1/2 centimeter. Okay? That means 1.5 centimeter beyond the articular margin. So if this is the articular surface, right? If this is the articular surface, so 1.5 centimeter approximately beyond it, the attachment is there in case of femur. Now, whenever the attachment is there in the femur, some important features are also there. The line of attachment. So this diagram is showing the line of attachments. So first you have to write the line of attachment for femur and second the line of attachment for the tibia. Now in the line of attachment, as I have mentioned, in case of femur, it is extending 1.5 cm, approximately 1.5 centimeter beyond the articular margin. So this is the articular margin and this is the line of attachment for articular capsule, okay, which is extending approximately 1.5 centimeter beyond. Okay. Now this is present on the posterior aspect also. Now what are the important points in that particular part which you have to mention? First is the anteriorly it is deficient. So here you can see a gap is there. So on the anterior aspect it is deficient. Why it is deficient and coming? Okay, there is a list. Now anteriorly it is deficient. Now if you see the posterior aspect, it is enclosing the intercondylar line and intercondylar fossa. So this is the intercondylar fossa, it is enclosing the intercondylar fossa. Now laterally it encloses the origin of the popliteus muscle. Okay, on the lateral aspect, okay, it will enclose the origin of the popliteus muscle. So that is for the femoral attachment. Next, for the tibial attachment, same thing, you can see extending approximately 1.5 to 2 centimeter beyond the articular margin, and anteriorly if you see it is descending towards the tibial tuberosity where it is deficient. Next, posteriorly it is attached to the intercondylar ridge. As you can see, posteriorly it is attached to the intercondylar ridge, and posterolaterally there is a gap. Okay, here you can see posterolaterally there is a gap. Why? So that the tendon of the popliteus can pass. Okay, posterolaterally there is a gap so that the tendon of the popliteus can pass. So these are some important features in the attachment of fibrous capsule in case of knee joint. Next, the synovial membrane is also there. Now, the synovial membrane is lining the inner aspect. तो ये जो inner aspect होगा, that is lined by the synovial membrane. Okay, and it gives extension to the cruciate ligaments and along with that infrapatellar pad of fat. Next, this particular extension of the capsule is attached to the patella also. Now, where it is attached to the patella? It is attached to the patellar articular surface superiorly, where it is blending with the quadriceps femoris tendon, and inferiorly with the ligamentum patellae. ठीक है, तो यहाँ पे अगर पेटेला रहेगा तो पेटेला के ऊपर क्या रहता है? quadriceps femoris tendon. तो this will go and extend and it will attach to the quadriceps femoris tendon. That's why here you can see the deficient, and inferiorly it is attached to the ligamentum patellae. Okay, so these are the attachments of the capsule with the patella. Now I am having one diagram. Here is the diagram. So you can see features of the capsular ligament. So suprapatellar bursa is there, which is piercing the capsule. This is also an important feature. Okay, then there are some important features of the capsular ligament. First of all, it is pierced by suprapatellar bursa. As you can see, it is pierced by suprapatellar bursa. Next, the capsule is strengthened posteriorly by oblique popliteal ligament. जो posterior aspect होता है of the capsule, it is supported by oblique popliteal ligament. Here you can see this is the oblique popliteal ligament which is supporting the capsule from the posterior aspect. That is one important point. Then a fibrous capsule is attached in front and the peripheral margins of the patella. Okay, here you can see it is attached to the peripheral margins of the patella. Then collateral ligaments are there. Okay, so here you can see the collateral ligaments. These are present over here. Now these collateral ligaments are also supporting the joint. Next, the femoral collateral ligaments are separated from the lateral side by the capsule. So two collateral ligaments are there, medial and lateral collateral ligament. Now one important point is there, जो medial collateral ligament है, ठीक है, that is attached to the capsule, but the lateral collateral ligament is separated from the capsule. That is important. That's why the chances of getting damage of the medial menisci is more as compared to the lateral meniscus. Okay, because the lateral collateral ligament is attached to the capsule. ठीक है. Next, here you can see one important point, that is the infrapatellar pad of fat. Okay, inside the joint. That is intracapsular. What is the meaning of this? Inside the capsule, but it is extra synovial. That means it is not covered by the synovial membrane. ठीक है. Now, what exactly is this infrapatellar pad of fat? It is a highly vascularized intracapsular extrasynovial tissue which is situated posterior to the tendon, patellar tendon, and it protects the articular tissue as shock absorber during the various knee activities. So whenever you are running, jumping, okay, it acts as a shock absorber. Now from this a specialized cells are derived, that is called as mesenchymal stromal cell. So whenever osteoarthritic changes are taking place or suppose any damage is taking place, this particular cells which are present in the infrapatellar fat pad helps in the healing of the joint. Okay, that is the importance of infrapatellar fat pad. Okay, now there is a applied aspect of this infrapatellar fat pad, and that is called as Hoffa's impingement syndrome. Hoffa, Hoffa_S, Hoffa's, okay, impingement syndrome. That we'll discuss in the applied part. Okay. Next is the tibial and fibular collateral ligaments. ठीक है, तो I have shown you the collateral ligament. I have mentioned the importance of collateral ligament in case of hinge joints. ठीक है. Now here what you have to know from where to where the collateral ligaments are extending, both laterally and medially. Now tibial collateral ligament is a strong, thick ligament that is having superficial part and deep part. So this is the tibial collateral ligament, and here you can see this is the fibular collateral ligament, or also called as lateral collateral ligament. ठीक है, तो what are the attachment? It is having femoral attachment and then fibular attachment and tibial attachment respectively. Now जो tibial collateral ligament है, I am talking about this one. Now this tibial collateral ligament is having two parts, superficial part and one deep part. Okay. Now you have to know what is the attachment. So if you see the superficial part, above it is attached to the medial epicondyle of the femur. Okay, and lower part is attached to the posterior part of the medial surface of tibia. Okay, posterior part of the medial surface of tibia. Next, the deep part is blending with the capsule. That means the deep part जो होता है, it is attached to the capsule. Okay, and it extends from the medial condyle of the femur to the medial condyle of the tibia above the gastrocnemius. Okay, above the groove of semi-tendinosus. So this is the semi-tendinosus. इसके ऊपर एक groove रहता है in the tibia. So that particular part is the tibial attachment, and above it is attached to the medial condyle of the femur. So that is the extent for the deep part. Okay, and deep part is attached to the capsule. जो laterally capsule रहता है, articular capsule, उसके साथ attached रहता है. ठीक है. Now for that clinical significance is there, that will be discussed later. So this is the medial collateral ligament. Next you can see the lateral collateral ligament. See, this is the lateral collateral ligament. Have you studied the fibula? Fibula class में हुआ है? Fibula. तो do you know that fibula is having a styloid process? कहाँ पे रहता है styloid process fibula का? Yes, near adjacent to the head. Have you studied how to hold the fibula in proper anatomical position? Then you have studied what you have studied fibula. कोई भी bone हो osteology में, you must know how to hold it in proper anatomical position. How will you hold the bone in proper anatomical position in case of, I know it's not an osteology class, though you have studied the fibula, that's why I'm asking. See, why I am asking, if you see the fibula, if you take the fibula in your hand, कौन सा upper end है, कौन सा lower end, it's very difficult to identify. ठीक है, दो upper end, lower end almost same दिखता है. ठीक है, but we know that upper end में head रहता है, and along with the styloid process is there. Lower end में नहीं रहता, but it's very difficult. So there is a trick to hold the fibula. तो क्या करना होता है, fibula का जो lower end है उसमें एक fossa रहता है, that is called as malleolar fossa. तो what you have to do, you have to put your thumb on the malleolar fossa. Suppose ऐसे malleolar fossa है, put the thumb on malleolar fossa and hold the bone like this. Okay, so this is the way to hold the fibula. Now I don't have fibula, that's why I can't show you. Always keep that in mind. This is the best way to hold the fibula. ठीक है, malleolar fossa triangular रहता है, छोटा सा डिप्रेशन होगा, ट्रायंगुलर शेप पे डिप्रेशन. तो जो ट्रायंगुलर शेप पे डिप्रेशन है, तो अपना थंब वो ट्रायंगुलर शेप पे डिप्रेशन में डालना है, एंड देन लाइक दिस यू हैव टू होल्ड, ऐसे करके. ठीक है, तो जो ऊपर रहेगा दैट विल बी द हेड, एंड एडजेसेंट टू दैट styloid process will be there. This is the easiest way to hold the fibula in proper anatomical position. Rest you by heart everything, एग्जाम के टाइम में कुछ याद नहीं रहेगा. Okay, तो fibular collateral ligament. So here you can see the fibular collateral ligament. Now the fibular collateral ligament is a fibrous band which is extending from the lateral epicondyle of the femur to the head of the fibula. You can see lateral epicondyle of the femur to the head of the fibula. ठीक है. Now this particular fibular collateral ligament is not adherent to the fibrous capsule. तो जो fibrous capsule होता है laterally, the fibular collateral ligament is not attached to the fibrous capsule. That you have to mention. Okay, why? Because there is a gap for the passage of tendon of popliteus. Popliteus tendon pass hota hai, that's why a gap is there, and because of that gap it is not attached to the fibrous capsule. And along with that, the tendon of the popliteus, inferior lateral genicular vessels and nerves are also passing. Okay, so these are some important points related to the lateral and medial collateral ligaments. Okay, now the collateral ligaments, already I told you what are the functions in case of hinge joint. Now in case of knee joint, the collateral ligaments are taut when knee are fully extended. When both the knee are fully extended, at that time the collateral ligaments are completely taut. Okay, and contributing stability to the joint whenever a person is in erect posture. This is one of the most important function of the collateral ligaments. Now as the flexion proceeds, that means whenever there will be initiation of the flexion, so this is the extension. After that, when the flexion will start, okay, from the extension, now they become increasingly slack, permitting the rotation of the knee, limited rotation of the knee, because whenever extension से ऐसे flexion आ रहा है, at that time थोड़ा सा rotation होता है, so that rotation must be limited or else dislocation हो जाएगा. So that small amount of rotation is permitted, but it is checked by these two collateral ligaments. Okay, so these are some important functions of the collateral ligaments of the knee joint. Next are the other ligaments, oblique popliteal ligament and arcuate ligament. Can you see the oblique popliteal ligament? ये देखो, this is the oblique popliteal ligament and this is the arcuate ligament. Two important ligaments which are present on which aspect of the knee joint? Posterior aspect of the knee joint. Okay, and the main function of these ligaments are to support the joint. ये जो दो ligaments होता है, it is supporting the capsule from posterior aspect. Now oblique popliteal ligament is a continuation of expansion from semimembranosus. ये जो semimembranosus है, from the semimembranosus you can see it is an extension. Okay, now what is the attachment? Intercondylar line of lateral condyle of femur. So you can see it is extending laterally. So if you see the superior attachment, it will be on the lateral side. So it is attached to the intercondylar line and lateral condyle, and inferiorly medial condyle of the tibia. As you can see, it is medial condyle of the tibia. Now, some important relations are also there. That means this particular oblique popliteal ligament is closely related to the popliteal artery. Now, this is the popliteal fossa. ये वाला जो part है, this is the popliteal fossa. That day you have studied about the popliteal fossa also. Popliteal fossa का class हो गया. तो ये वाला जो part है, this is the popliteal fossa. This is forming the floor of the popliteal fossa, right? Oblique popliteal ligament, floor of the popliteal fossa में रहता है. Now this oblique popliteal ligament is closely related to the which artery? Popliteal artery. ठीक है? Now this particular ligament is pierced by some important structures. What are those structures? Medial genicular vessels, medial genicular nerve, and terminal part of posterior division of the obturator nerve. These are the three structures which will pierce the oblique popliteal ligament and then it will enter the knee joint. Okay? तो यहाँ से short question आता है. The structures piercing the oblique popliteal ligament. Next is the arcuate ligament. So what is the meaning of arcuate? Arcuate का meaning क्या होता है? Arc shaped. ठीक है? Arcuate का meaning होता है arc shaped. Can you see any ligament arc shaped over here in the diagram? Arching over some structure. So arcuate ligament is Y-shaped fibrous band. Now, उसका जो stem होता है, that is fixed to the styloid process. You can see it is fixed to the styloid process of the fibula. Okay, and two bands are there, anterior band and posterior band. Now, if you see the posterior band, it is arcing over the popliteus muscle. Okay, ये देखो. So this is the styloid process of the fibula. तो यहाँ से Y-shaped, can you see Y-shaped? Arcuate ligament. So it is Y-shaped, and why it is called as arcuate ligament? हाँ, because जो posterior band होता है, So this Y-shaped stem is attached over here to the styloid process, okay, and then it is divided into two bands, posterior band and anterior band. So this is the anterior band and this is the posterior band. Now this posterior band is arcing over the popliteus muscle. ये देखो, this is the popliteus muscle. The popliteus muscle के ऊपर से जाता है and then it is blending with the fibrous capsule. तो ठीक है, so that's why it is called as arcuate ligament. Now posterior band arcing over the popliteus muscle attached to the lateral condyle of the tibia. Okay, here the lateral condyle is there, so it is attached to the lateral condyle of the tibia. Okay, now if you see the anterior band, it passes deep to the fibular collateral ligament and it is attached to the lateral condyle of the femur. It will go and it will attach to the lateral condyle of the femur. That is the arcuate popliteal ligament. So these are the two important ligaments present on the posterior aspect of the fibrous capsule, supporting the joint from posterior aspect, mainly the capsule from the posterior aspect. Okay, those points will be required in the stability of joint. I am coming to the stability. Those points will be required. As a whole, we will see the stability of the joint. Okay, next, as I said, list is huge. Okay, so we have to study about all the ligaments. Next is the menisci of the knee joint. So this is the diagram showing the menisci of the knee joint. Very important. In the beginning, in the classification, I have mentioned that it is a complex joint also, it is a compound joint also. Okay, why? Because three bones are forming the joint and it is partially divided into two compartments, superior compartment and inferior compartment by menisci. Okay, so what exactly are those menisci? If someone asks you the menisci, what are those menisci? क्या होता है? These are pad of fibrocartilage. ये जो menisci है, these are the pad of fibrocartilage which are present in the knee joint. Okay, as you can see, this is the medial meniscus, this is the lateral meniscus. Okay, main function क्या है? Menisci का main function क्या है? To divide the joint cavity into two compartments. Okay, this is the upper compartment and this is the lower compartment. Now don't write upper and lower, it doesn't look nice. What you have to do, you have to write meniscofemoral compartment and meniscotibial compartment. ठीक है, दो compartment में divide करता है. Now what is the requirement for this? From here the complexity arises. ठीक है, till now whatever we have discussed, that was a small part. यहाँ से complexity होगा, complexation start. ठीक है, तो ऑलवेज कीप दैट इन माइंड, जो जॉइंट का कैविटी दो कंपार्टमेंट में डिवाइड होता है, द मूवमेंट्स ऑफ दोस पर्टिकुलर जॉइंट्स आर वेरी कॉम्प्लिकेटेड. व्हाई? दोनों कंपार्टमेंट में मूवमेंट्स होता है, दैट आल्सो अराउंड डिफरेंट एक्सेस. ठीक है, इसका मतलब क्या है, ये जो मेनिस्कोफेमोरल कंपार्टमेंट है, यहाँ पे एक टाइप का जॉइंट मूवमेंट होगा एंड इन दिस कंपार्टमेंट सेपरेट टाइप ऑफ मूवमेंट विल बी देयर. दोनों का एक्सेस अलग होगा. ठीक है, and type of movement will also be different, and that is the, you can say, complicated part. Anyway, in the beginning I have mentioned it is the most complex joint of our body. ठीक है, तो you have to study. Now if you see the meniscus, so two menisci are there, medial meniscus and lateral meniscus. If you see the medial meniscus, what is the shape? Semilunar shaped, and lateral meniscus it is circular shaped. तो दोनों का शेप भी अलग अलग है, it's not same. ठीक है, next if you see the parts, so various parts are there of the menisci. Okay, so two ends are there, that is called anterior horn and posterior horn. ठीक है, two ends are there, it is anterior and posterior, also called as two horns. Two borders are there, that is the outer thick convex border and inner thin concave border. Okay, convex and concave border. And then two surfaces are the upper surface which is concave and lower surface which is flat. So these are the parts of menisci, both the menisci. ठीक है. Next, if you see the function of the menisci, first of all it will increase the concavity of the tibial condyles. Next, it helps in lubrication. That means जो synovial fluid produce होता है from the synovial membrane, it will help to distribute the synovial fluid across the joint cavity. ठीक है, which helps in lubrication. Next, shock absorption. and proprioception and protection. Proprioception means proprioceptive nerve endings are there. So from there, proprioceptive sensation are arising. Okay, which is very important to know the sense of position of that particular joint. Okay. Now here is so here you can see the diagrams. So this you can see this is the lateral meniscus and this is the medial meniscus. Okay. So you can see horns are there. So this is the anterior side, this is the posterior side. So this will be the anterior horn, this is the posterior horn. Okay. Here also anterior horn, posterior horn. Now this is the concave border and this is the convex border. Okay, ये वाला. This is the concave border and that is the convex border. Okay, inner border, outer border. Next, if you see this particular surface, this is the superior surface which is concave और उसके नीचे जो है that is the inferior surface which is flat. ठीक है. Next, if you see the comparison between these two menisci, okay. So first of all, if you see the medial meniscus, what is the shape of the medial meniscus? It is C-shaped or semilunar, as you can see in the diagram. Lateral meniscus, it is oval shaped, okay, or almost circular. Next, attachment, it is attached to the medial collateral ligament. The medial meniscus, you can see it is attached to the medial collateral ligament, but here attached to the tendon of the popliteus muscle. So in the beginning I have told you, okay, जो meniscus होता है lateral meniscus, you can see it is not attached to the capsule. There is a gap, and what is passing through the gap? Tendon of the popliteus muscle. Okay. Next, mobility. It is less mobile medial meniscus. It is highly mobile. Blood supply, it is less. Here it is better. Now, chances of injury in case of medial meniscus, it is more, and in case of lateral meniscus, it is less prone to injury because of the attachment. Okay? So these are some important differences. Now, if I want to conclude and if I ask you what are the functions of menisci, what will be your answer? Here you can see the list of functions. So first of all, they help in making the articular surfaces more congruent. Okay. Then because of their flexibility, they can adapt their contour of varying curvature of the different parts of the femoral condyles and later over the tibia. Next, the menisci helps in shock absorber, help in lubricating the joint cavity by spreading or distributing the synovial fluid across the joint cavity. Next, because of their nerve supply, they also have sensory function, that is the proprioception. Next, they give rise to proprioceptive impulses, and this is the most important function, divides the joint cavity into two compartments, superior compartment and inferior compartment. Superior compartment में क्या है? Meniscofemoral compartment, and inferior one is meniscotibial compartment. Now, please keep that in mind whenever you are mentioning about the compartments. Okay, you have to mention what are the movements taking place in those compartments. Okay, because as I said, whenever the compartments are there, movements taking place in those compartments are different, not same. So if you see flexion and extension, which is the chief movement, or you can say main movement of the knee joint, they are taking in the superior compartment. It is the meniscofemoral compartment. And along with that, the conjunct rotational movements which are taking place, they are taking place in the inferior compartment, that is the meniscotibial compartment. Okay? So that is the overall function of menisci. Okay? So let's take a break of 10 minutes. Okay? After that, I will continue. And listen, anyhow, I have to complete the structure as well as movements of the knee joint also. Okay? So structure almost done, few parts are left and followed by the movements. Okay? So let's take a gap of 10 minutes and then we'll continue. Which condyle? Anterior one is extending from the lateral condyle, okay, and posterior one is extending from the medial condyle. And anterior one, when it is extending, it is attached to the anterior part of the intercondylar area. Posterior one is attached to the. Wait. I said 10 minutes. Get out. Close the door. No one is allowed to enter. Okay, so that is the attachment. Now here also you can see the attachment. So this is the superior view of the knee joint. Here you can see the attachment. So this is the anterior side. Okay, this is the anterior side. This is the posterior side. Now here you can see the attachment of the two ligaments, anterior cruciate ligament and posterior cruciate ligament. ठीक है, तो main function of these cruciate ligaments are they prevent the anterior dislocation, anterior dislocation, and posterior prevents the posterior dislocation. Okay, next anterior one prevents hyperextension, posterior one prevents hyperflexion of the knee. These are two most important functions of the ACL and PCL. Okay. Next, the function. So here you can see ACL is taught during extension and PCL will be taught in flexion, as I mentioned earlier. Next, prevents the excess medial rotation of the tibia. Okay, and in case of PCL, it is taught during flexion and prevents the anterior dislocation of the femur on tibia and prevent the hyperflexion of the knee. So these are some important functions of the ACL and PCL. No, not allowed. Not allowed. Next, transverse ligament and coronary ligaments are also there, but these are not that important. So I will request everyone to study from your own about the transverse ligament and coronary ligament. Here you can see the transverse ligament, and here you can see the coronary ligaments. Okay, so many ligaments are there. These are not that important. So I will request everyone to study from your own about these two ligaments. Now, after that, so this diagram is showing the bursa. So same like the hip joint, in knee joint also some bursae are present. Okay, so approximately 12 bursa are present around the knee joint, and it is divided in anterior, three different groups: anterior group, medial group, and lateral group. Okay, so these are the three groups in which the bursa are divided. So here you can see the different bursa. Okay, so suprapatellar bursa. Here you can see the subcutaneous infrapatellar bursa. So these are the locations. This diagram is showing the various locations of the bursa where they are situated. Okay. Now the positions of the bursa are important. Why? Because in the applied part, some applied importance are there which are closely related to this bursa. For example, Baker's cyst. I hope you have heard about the Baker's cyst. Okay, that is also related to the bursa of the knee joint. Next, the relations of the knee joint. So this is the superior view of the knee joint, where this is the posterior side, this is the anterior side, this is the medial side, and this is the lateral side. Okay. So mostly, if you see the muscles, okay, mostly they are situated on the posterior and on the lateral aspect. Similarly, if you see the blood vessels and nerves, important blood vessels and nerves, they are also situated on the posterior aspect and the lateral aspect. Okay. So this is an easy diagram showing the relation. So nothing is there to explain, just simple the diagram and what are the structures present on the posterior aspect, lateral aspect, and the anterior aspect, that only you have to draw. Okay. And whenever you are doing such kind of diagrams, please don't forget to mention this particular symbol, or you can write from your own, which is anterior side, which is posterior, which is lateral and medial. Okay, next is the blood supply, very important. Now, I hope you have observed that in most of the large joints which are present in our body, around that a arterial circle is formed or anastomotic circle is formed. Have you noticed that? In case of hip joint also you have seen one arterial circle is formed. Next, when you have studied about the elbow joint in upper limb, at that time also you have seen. Okay? Now same thing is present in around knee joint also. So you can see the arterial anastomosis which is present around the knee joint. And from there the branches will appear and will supply the joint. Now, first of all, 5 genicular branches are there, and those genicular branches are from popliteal artery. Okay, जो popliteal artery है, from yesterday in popliteal fossa, I think someone has explained about the popliteal artery. Which group has explained about the popliteal artery? Raise your hand. So how many genicular branches are there? 5 genicular branches are there. Can you see those genicular branches in the diagram? Yes. So those genicular branches. So these are the major arteries supplying blood to the knee joint. Okay. Now along with that, descending genicular branches which is coming from femoral artery. Then 2 recurrent branches coming from anterior tibial artery and circumflex fibular branch of the posterior tibial artery. So these are the branches, okay, which you can see forming a arterial anastomotic circle around the knee joint and then supplies the knee joint. Okay, very simple. Next is the innervation, that is the nerve supply. Anyone, do you remember about the Hilton's law? क्या होता है Hilton's law? In synovial joint chapter, you have studied about the Hilton's law. ठीक है? तो Hilton's law is also applicable in case of knee joint. Okay? Now, in case of knee joint, you can see it is supplied by the branches of femoral nerves that also branches from the vasti. Along with that, we are getting the tibial nerve, common fibular nerve. Now, these particular nerves, they are supplying the muscle acting on the joint and they are also supplying the joint. Now, this particular nerve, they supply the anterior, posterior and lateral aspect of the joint. Okay? Next, in addition to that, obturator and saphenous cutaneous nerve are also supplying and they are supplying the medial aspect of the joint. In synovial joint chapter, I have also mentioned that joint का जो movement होता है, for that segmental innervation is there. That means some particular segments of the spinal cord will control those movements. Those are called as segmental innervation. ठीक है? Now, in case of knee joint, as you can see, 4 consecutive spinal segments, okay, are supplying the or controlling the movements of the knee joint. ठीक है? Among them, L3, L4 regulate the extension, L5, S1 regulate the flexion. Okay, so these are the segmental innervation for knee joint. Okay, so that's all about the ligaments, blood supply, nerve supply. Lastly, the stability of the knee joint. So, what do you think? What are the factors that will provide stability to the knee joint? Ligaments and muscles in this case. Okay, mainly ligaments and muscles are providing support to the knee joint. Okay, first of all, the strength of the surrounding muscles and their tendons, along with their ligaments which connects the femur and tibia, and the most important muscle is the quadriceps femoris, particularly the inferior fibers of the vastus medialis and lateralis. Okay, which provides the stability to the knee joint. Now, in erect position, that also in the extended position, that means when the knee is extended, it is the closed pec position. Yesterday, sir has asked you one question related to the hip joint, that when is the closed pec position and when is the loose pec position of the hip joint. Okay? Now, in case of knee joint, which one is the closed pec position? Extension, complete extension. Okay, I said, when complete extension is there, at that time, it is closed pec position. And in case of flexion, it is loose pec position. Okay, for the knee joint. So these are the stability. These are the factors which provide stability to the knee joint. So that is all about the structure. Now the last part which is left, that is the movements of the knee joint. Okay. So we'll start with the movements of the knee joint. So chief movement, or you can say the main movements which are taking place in the knee joints, what are these 2 movements? Flexion and extension. Along with that, some conjunct rotations are also taking place, that is the medial rotation and lateral rotation. Okay? So in case of movements, you have to mention that flexion extension is the chief movement and some conjunct rotational movements are also taking place, that is the medial and lateral rotation. Now, flexion and extension, they are taking place in which compartment? In the upper compartment, also called as meniscofemoral compartment. Can anyone tell me what happens in case of flexion? If someone asks you, define flexion. Yes? Yes, very good. Okay, so same thing is taking place over here. That means in flexion, the posterior angle of the thigh and the leg decreases. Okay, so like this. See, the angle decreases. So this is the flexion of the knee joint. Suppose I am standing straight, I am doing flexion of the knee joint. So the angle between the knee and the thigh, angle between the leg and the thigh decreases. That is the flexion. Whereas extension, reverse is taking place. That means the angle increases. Okay, so that is the definition for the flexion and extension in case of knee joint. Now, what is the axis of movement? So, always whenever you are mentioning the movement, you have to mention the axis. Repeatedly, I am mentioning this. Okay. Now, in flexion and extension, it takes place around transverse axis, but the axis is not fixed. Please note that. We know that flexion and extension around transverse axis. In case of knee joint, the axis is not fixed. Okay. Now the axis moves forward and upward in extension and reverse in flexion. Okay. So that is also a peculiarity in case of knee joint. Knee joint में जो flexion extension होता है, उसका जो axis है, that is not fixed. It is movable. It is moving. Okay. And what is the direction of the movement? That is forward and upward in case of extension. और उसका reverse होगा in case of flexion. ठीक है? These are the points which must be there whenever you are writing about the axis, especially in case of knee joint. Now I want to show you some images, or you can say animations. Can anyone identify which is flexion and which is extension? What is this? नहीं ये क्या है? Which movement is this? Flexion, and which is this? Extension. Very good. Now, can you see the pull of the muscles? Can you see the angle decreasing? Now, reverse thing is taking place over here. Okay. Now, yesterday the group who have presented the hip joint. Okay. I was having some animations. I have shared those animations with them. Okay. I don't know what is wrong with them. They have taken the screenshot of the animation and then they have pasted together. I told them that these are animations, paste them separately, write the name of the motion. That also I have written. Okay, and then explain. That will look attractive. Okay, whenever you are presenting in front of some audience, it must be attractive. ठीक है? तो मैंने भेजा था. You can check, it is there in the group. Okay, see how talented they are. They have taken the screenshot. Have you understood those group who have done the presentation? Who have done the presentation for hip joint? समझ में आया? क्या? क्या नहीं आया? अरे एनिमेशन फोन में नहीं आएगा, तो पीपीटी में आएगा. तो पीपीटी का एनिमेशन है. स्क्रीनशॉट क्यों लिया था? ठीक है बैठ जाओ. No problem. Anyway, okay. So here you can see the movements, and along with that the muscles. Stop talking. You can see the movements. This is the extension. This is the flexion. You can see the movements, and you can also see the muscles causing them. Till now, I have not explained about the muscles. I am coming into that. But here you can see the group of muscles causing extension, and you can see the group of muscles causing flexion. Okay, and the angle how it is decreasing in flexion and how it is increasing in extension, that can be seen. Okay. Now, please note that the flexion extension, which you can see in this particular animation, दिखने में बहुत easy दिख रहा है, but actually it is not that simple. Okay, actually it is not that simple. Now what happens? The movements of the flexion and extension are associated with conjunct rotation. For example, full flexion is completed. Full flexion is completed. That means from extension gradually when you are doing, and after that you are doing the full flexion. Now that is associated with the medial rotation of the femur on tibia when the foot is on the ground. Okay, so see, in case of full flexion, there is medial rotation of the femur, okay, on tibia when foot is on the ground. Next, in such cases, the medial rotation is done by vastus medialis muscle, okay, and that is called as locking of the knee. Now, in case of full extension, okay, when the full extension is there, at that time what happens? Medial rotation of the femur is taking place. In case of full extension, okay, the medial rotation of femur is taking place when foot is on the ground, and that medial rotation is done by vastus medialis, and that phenomena is called as locking of knee. That phenomena is called as locking of knee. Now, in the beginning of the flexion, so full extension ho gaya. Now, in the beginning of the flexion, at that time what happens? Lateral rotation of the femur is taking place, and that is called as unlocking of the knee. And in that case, the lateral rotation is done by the popliteus muscle. Okay. Next, the medial and lateral rotation, where it is taking place? It is taking place in the lower compartment, meniscotibial compartment. Okay, where the rotation, the range of rotation is very less. Now, the axis for the movement for this rotation is vertical axis, okay, which is passing through the ACL, anterior cruciate ligament. Okay. Now, we have to understand the sequence of the event, okay, sequence of the event from full flexion to full extension. That means this is the full flexion, from full flexion, full extension. ठीक है, extension में close back position होता है. So this is the full flexion. You can see this is the full flexion. From full flexion, this is the extension. तो ये जो full flexion से जो extension हो रहा है, in that some sequential events are taking place. That you have to understand, and that is the main part of the movements of this one knee joint. Okay, I am having one diagram. Let me show you. This one. So whatever I am going to explain, please compare with the diagram. And what I have decided, next week during osteoclasses, with the help of the bones, it will be shown. I thought of bringing the bones and show, but I know it's very difficult. The last bench student sitting in the last bench will not be able to see the bones. So this thing next week in the osteology class will be shown separately. Okay, the movements. Now, whatever I am going to explain, what you have to do, compare with this diagram. So, from where to start? That means the sequence from full flexion to full extension. Okay. Now, in extreme flexion, when extreme flexion is there, at that time what happened? Posterior convex part of both the femoral condyle. Okay, as you can see, posterior convex part of both the femoral condyles are resting on the posterior horn of the menisci. Now, when I have explained you the meniscus, I have told you that anterior horn is there and posterior horn is there of the menisci. So, whenever the extreme flexion is there, as a extreme flexion, जब खत्म हो जाता है flexion, at that time what happens? The femoral condyles, they are resting on the posterior horn. Okay, they are resting on the posterior horn of the menisci. As you can see, they are resting on the posterior horn of the menisci. Okay, first point. Next, as the extension begins, that means ये full flexion हो गया, इसके बाद flexion नहीं हो रहा है. इसके बाद जब extension start होगा, when the beginning of the extension is there, at that time what happens? As you can see, the rolling is taking place. Okay, that means both the femoral condyle roll forward on the upper surface of the menisci. Okay, like this, the femoral condyle will roll forward. ऐसे rolling होके forward जा रहा है on the upper surface of the menisci. Next, what happened? At that time, the transverse axis shift forward. So, though it is rolling, at that time the transverse axis which is there, it is shifting forward. Okay. Now, the forward movement of the axis is limited by PCL, posterior part of the PCL and posterior part of the capsule. तो ये जो rolling हो रहा है, this rolling is further prevented. Some rolling is there, further it is prevented by the posterior cruciate ligament, oblique popliteal ligament and posterior part of the capsule. Okay. Now once it is arrested, तो rolling arrest हो गया, मतलब इससे पहले और rolling नहीं होगा. But we have to do the extension. At that time, what happens? Once the rolling stops, the spinning will start. I hope you know the difference between the rolling and spinning. Now, the lateral meniscus at that time, what happens is, we know that lateral meniscus is shorter as compared to the medial meniscus, and I have shown you in the diagram also. Therefore, the lateral femoral condyle reaches the anterior horn earlier as compared to the medial femoral condyle. Okay, as you can see, transverse section shift forward. Okay, now the meniscus, the lateral femoral condyle, which is there on the lateral meniscus, will reach the anterior horn first as compared to the medial femoral condyle. Okay, now at this stage, what happened? The medial femoral condyle has not yet reached the anterior horn. At that time, the anterior cruciate ligament ACL will become taut. Okay, and around that, the vertical axis is formed through which the medial femoral condyle rotates backward and medially. Okay, the medial femoral condyle will rotate backward and medially. Now, simultaneously, the lateral femoral condyle will glide forward with the lateral meniscus, as you can see in the diagram. Okay. Now, this excessive forward gliding, so gliding jo ho raha hai, this excessive forward gliding is prevented by meniscofemoral ligament, and the final 30-degree extension, okay, is which is taking place, that is called as locking mechanism. That means ये जो medial femoral condyle का rotation होता है, okay, backward and medially, that is locking the knee joint, and that takes place in the last 30-degree extension of the knee joint. Okay. Next, what happens in full extension? The ligaments are taut and joint surfaces are mostly congruent. Now, after that, from there, okay, so that is the unlocking. Now, from there, if you start the flexion, at that time, what will happen? You have to unlock the knee joint. For that, what will happen? There will be lateral rotation of the femur. As you can see, the lateral condyle glides backward. Okay, and that is done by the activation of the popliteus muscle. The flexion begins by unlocking. Now, how the unlocking is taking place? By the lateral rotation of medial femoral condyle. In both the cases, medial femoral condyle is only rotating. Okay. In case of locking, it is rotated medially. In case of unlocking, it is rotated laterally. And that is assisted, or that is done by the popliteus muscle. Okay. Next, when the tibia is fixed, okay, now these movements occur in the femur. That means when the tibia is fixed, for example, if you are standing like this, how you will do the flexion and extension of your knee joint? When the tibia is fixed, how you will do? Now this I have shown you when this one tibia is not fixed, when foot is off the ground. Now if the foot is on the ground, how you will do the flexion extension? Whenever you are sitting and whenever you are standing. In sitting standing में क्या होता है? Whenever you are sitting like this, क्या हो रहा है? Flexion हो रहा है, ऐसा extension हो रहा है. Okay. So in both the cases, the rotations are different. Now, when the tibia is fixed, that is when foot is on the ground, which I have shown you just now, these movements occur in the femur. Now, when foot is off the ground, that means when foot is off the ground, this one. Okay, at that time what happens? The medial tibial condyle rotates laterally in extension and medially in flexion. So when foot is off the ground, medial tibial condyle, the rotation is taking place laterally in extension and medially in flexion. Okay. See, this is a animation. This is the locking. Okay, this is the unlocking. Now see the sequence. So this is the flexion, this is the extension. Now see, at the termination of the extension, you can see the lateral rotation is taking place. Medial rotation is taking place. Okay, ये देखो. This is the This is the terminal of extension. Now this is the unlocking and then flexion starts. Have you understood? Just see the animation again. Okay, so femur rotates externally and then femur rotates internally. Now when it is rotating medially at the terminal 30 degree of extension, that is the locking. Now when it is moving medially, when it is rotating medially, then see this is the unlocking and then the flexion starts. Abhi samajh mein aaya? What is locking and unlocking? See the animation again. See ये flexion है, यहाँ से extension हो रहा है, extension हुआ, then see this is the medial rotation, complete lock हो गया. अभी ये देखो unlocking हो रहा है, lateral rotation and then flexion starts. I hope it is clear. Now what we will do, we will see a comparison between the locking and unlocking so that the things will get clear. Now here you can see the differences between the locking and unlocking of the knee. ठीक है? So what is shown first of all, where it is occurring, the locking in last phase of extension. Just now I have shown you in the animation where it is taking place in the last phase of extension. Unlocking कहाँ पे होता है? In the beginning of the flexion. Then when the movement is there, when foot is on the ground, medial rotation of the femur is taking place, okay, and lateral rotation of the femur is taking place in the unlocking. When foot is on the ground. Now this is also important. Foot on the ground different, foot off the ground it is different. And that you have to mention. Now movement when the foot is off the ground, at that time lateral rotation of the tibia is taking place. In case of locking and in unlocking, medial rotation of the tibia is taking place. Okay. Next, ligaments. In case of locking, they are taut and here they are relaxed. Okay. Now joint rigidity, joint becomes rigid and joint become flexed. So these are some differences between the locking and unlocking. Okay. So that is all about the locking and unlocking mechanism of the knee. Now in the exam, whenever you are getting the questions from movements of the knee joint, if you write only flexion and extension, muscles causing flexion and extension, okay, that is not enough. Along with the flexion and extension, you have to mention the locking and unlocking mechanism of knee joint. Okay. Without that, it is incomplete. Next, whenever you are mentioning the locking and unlocking mechanism, at that time you have to mention two conditions: when foot is on the ground and when foot is off the ground. Is it clear? So, what is the best way? The best way is to study this chart. इसमें सब कुछ दिया हुआ है. Okay. So that is all about the movements. Now the muscle causing. Can anyone tell me which muscle will cause the extension of the knee? Knee joint. Quadriceps femoris. As simple as that. Which will cause the flexion? So they are called as hamstring group of muscle. Very good. Next, in case of medial and lateral rotation, popliteus causing lateral rotation. And what about the medial rotation? Vastus medialis. Okay. To see, without looking at the diagram, by understanding the facts, you could have given the answer. Okay. So study accordingly. नहीं तो during the time of exam, सभी joints का structure, सभी joints का movement, okay, it will mix. Nothing will come to write the answer. Okay. Lastly, this is the chart. Okay. So I'll request everyone to see the chart properly. So इसमें movements दिया हुआ, what are the movements taking place? Even the degrees of movements are also mentioned. That means the range of movement. Then the muscles producing the movement, primary, secondary. Okay. Factor limiting the movement. In synovial joint, the movements which are taking place, there is a certain limit or certain range. Beyond that, movements will not take place. For that, certain factors are responsible, and the list is given. All those things are discussed earlier, and lastly some important comments or important points related to these movements are given. Okay, so I'll request everyone to please go through this chart. Okay, you will come to know many things related to this knee joint, especially the movements of the knee joint. Okay, now as I said, next week during the osteo classes, as I said, I will take the bones, especially the bones forming the knee joint. Okay, and then I will show you the locking unlocking mechanism. Again, it will be explained so that whatever doubts are there, it will get cleared. Okay, this is a very important topic, and you can expect some questions in the exam. Plus, another class is there where the applied aspect will be discussed. Till now, I have not discussed any applied part of the knee joint. So many applied parts are left. Okay, that will also be discussed. Okay, so I hope you got a clear-cut idea about the knee joint, how to study, what are the points. Yes, so please revise the knee joint again. It's not that simple, and the discussion part will be continued next week also for the knee joint. Okay, thank you.